Good morning, everyone. Welcome to Sulong sa Bagong Pilipinas, a roundtable discussion focused to highlight Filipino pride beyond our borders. So I am 𝐏𝐀𝐅𝐵𝐴, your host for today's event.
And I'm Franco Baranya. Let's get to the details. The Commission on Filipino Overseas continues to champion our overseas Filipinos, especially those creating waves of excellence beyond our borders. Recently, President Ferdinand Marcos Jr. and the CFO recognized 13 individuals for this year's 2024 Presidential Awards for Filipino individuals and organizations overseas.
Now we have proceeded with our special roundtable talk show where we celebrate leaders who are bridging borders and breaking barriers. Today we'll uncover the inspiring stories of individuals who have redefined what it means to create lasting change across fields and communities. So our theme for today is bridging borders, breaking barriers, how leaders across fields collaborate to create lasting change. This promises to be an enriching and empowering conversation.
Joining us are 5 remarkable leaders, each a trailblazer in their own right.
So Dr. Melvin Senicas, a world-renowned vaccinologist and a global health advocate whose work has transformed community health initiatives around the globe.
Leo-Felix Jurado, an exemplary advocate for nursing profession, whose remarkable achievements as a nurse, educator, and leader have promoted inclusivity and paved the way for broader opportunities for Filipino nurses in the United States.
So next is Dr. Elvy Barroso, a dedicated tuberculosis advocate, leading impactful efforts to control and prevent tuberculosis, so particularly among immigrant workers in New York City.
Next is 𝐏𝐀𝐅𝐿, a dynamic leader in public health and nursing advocacy, known for growing PNANY into a global force advocating for Filipino nursing.
And next is Ms. Zita Cabais, a courageous voice for migrant workers' rights and anti-trafficking advocate, whose journey from labor exploitation, survivor to union leader in France, inspires many. And now let's start by diving into the regions of your incredible advocacy journeys. Every impactful leader has a defining moment or experience that shapes their vision. So I'd love to hear what inspired each of you to embark on this path. So Dr. Senicas, let's begin with you. Yes, sir?
For me, ma'am, I was really fascinated with the 1918 flu epidemic. When I was in high school, we were talking about it in science class, also in pre-med. And for me, when they say that this happens every 100 years, I was thinking in my mind, 1918, so baka magkaka-pandemic ng 2018. So I thought maybe I should study something related to this. So it was already in my mind that I should study something related to immunology, vaccines, and infectious diseases. And walang mangyari in 2018, but we know what happened in 2020. So I think that's kind of my origin story. Science, I was really very curious about this new pandemic.
That's incredible, Dr. Senicas. Sir Leo-Felix, you've been a trailblazer for junior nurses in the U.S. What inspired you to champion its cause?
Well, I guess the Philippine Nurses Association of America provided the platform for me. So in 1997, I became the president of the Philippine Nurses Association of New Jersey. From there, I was appointed by the governor of New Jersey to become a member of the New Jersey Board of Nursing, which is the highest regulatory body in the state. Luckily, I became the president of the board. And at that time, there were many challenges in terms of barriers for Filipino nurses coming to the U.S. You have to take the CGFNS exam before you can take the licensing exam in the U.S. So since I was at the New Jersey Board of Nursing, I thought that's duplication. And I worked for the removal of the CGFNS exam so that nurses could just take the licensing exam, which already available in many countries close to the Philippines, like in Saipan, like in Hong Kong. They could just take the licensing exam there. But prior to that, they have to take the CGFNS exam first. So that was duplicative, and I thought that since I have the ability to forward some regulatory regulations to the Board of Nursing, that basically inspired me to do more for Filipino nurses in the States.
Yes, such a visionary approach, Sir Leos. And now we proceed to Dr. Barroso. So I understand your advocacy has a profound impact on tuberculosis prevention in New York City. Can you share about that?
Yeah, so I came to New York City in 1992, and that was the time we had an epidemic of tuberculosis. So I saw on the newspaper the director of the Bureau of Tuberculosis Control, and I have a good background on tuberculosis because when I was in the Philippines, I was the NTP, the National Tuberculosis Program Coordinator of Region 4. So what I did, I sent to him my resume. In 3 days, he called me for interview and I got hired. So since then, I've been working under the Bureau of Tuberculosis Control for over 31 years.
That's truly remarkable, Dr. Barroso.
Thank you.
Janet Cuaycong. PNANY's global presence is inspiring. How did you grow this organization into such a remarkable force?
Thank you, Sir Frank. PNANY's advocacy is actually it's a professional organization. But with that, we also have a community service as part of our mission, not just for the nurses. And just with the recent pandemic, right, there was an issue wherein there was a delay or the release of our vaccines. So the Philippine Nurses Association, along with other associations, collaborate to discuss with the Senator Chuck Schumer, and several meetings happened to endorse and ensure the procurement and expedition of the 5 million vaccines to the Philippines. Yeah.
Okay. That's an amazing story of growth and impact. So lastly, Ms. Zita, your journey from a survivor of labor exploitation to a new union leader is so inspiring. Could you share what drove you to become a voice of migrant workers?
Good morning, Skit.
Good morning po.
Who drove me in my advocacy? Because I was a victim before. And I feel what the victim feels when they are victimized. And this experience drove me because I'm looking for justice by the time. And when my fine was endorsed to the union, I was really eager to know how to learn about the law and how can I protect or how can I obtain justice against my previous employer. And the union have seen that I am serious in getting in the union, and the labor union, I should say. And then they employed me in the labor union. And here I've seen that many workers coming in, and among them are Filipinos. So I've seen really that there is something missing in a sense that they don't know the rights, the language barrier, and there are lack of awarenesses. So this is the one, this is the point who developed my advocacy in the beginning.
Thank you, Ma'am. When we come back, let's talk about tackling global challenges and how the awardees work address critical global issues. This is Sulong sa Bagong Pilipinas, hosted by the Manila Times.
We are now back to Sulong sa Bagong Pilipinas, hosted by the Manila Times. Now, we talk about global challenges, tackling global challenges.
So moving forward, let's explore how your work addresses critical global issues. These are the challenges that require innovative solutions and collaboration across borders. So, Dr. Senicas, let's begin with you. How has your global health advocacy and work with vaccines helped tackle major health crises like the COVID pandemic?
I would say two things. One part is yung science misinformation. We know that it's really rampant nowadays. So during the COVID pandemic, I was really busy with addressing all these fake news and different disinformation and misinformation that was happening everywhere. So I was busy during that time on Facebook, Twitter, LinkedIn, wherever, right? Just to address all these things. And I was lucky because there were many people who were resharing those posts, right? And I was also coordinating with the WHO and just really making sure that our messages were aligned. The second thing I would say is pandemic preparedness. So there's this collaboration I started in 2014. It's called the Collaboration for TB Vaccine Discovery. Initially, it was just looking at ways for scientists all over the world to really come together and share resources, share knowledge. And initially, which is for TB. But during COVID, this was the same network that also shared information and resources for developing COVID vaccines. So I think it's two pieces, right? It's pandemic preparedness, infrastructure, and science, the science piece of it, but also misinformation and how we tackle that with education and really making sure that people are able to look at information and be critical about what they see and read, especially in social media.
And that's a vital contribution, Dr. Senicas. Ma'am Janet, PNANY's vaccine drive was also instrumental during the pandemic. Can you tell us more about collaboration and actions?
Sure. So, as I mentioned earlier, that the Philippine Nurse Association of New York, along with other organizations, really lobbied to ensure that we get the expedition of the vaccines to the Philippines. However, since we are nurses, our members, we continue to support and provide education, not only for the community and not only for the patients, but also the professional people like the nurses, the doctors, for the misinformation. So as Dr. Senicas was mentioning earlier, is providing them the latest informations that the importance of vaccines. So that is our task there. So Philippine Nurse Association is out there giving education not only for the community, but for the healthcare workers as well.
Okay. Information drive.
Information drive, yeah.
How do you reach your community?
So yes, so we there is a lot of community activities going on. So we tried to work with other partners, other organizations, and the community will come and we provide them with education. And we ask also not just for the COVID vaccine, but we do work with the Department of Health in terms of we have health information personnel who goes to ensure that these patients in the community are being, they're taking their medication or taking the vaccine. So it's one work the Philippine Nurse Association is collaborating with the Department of Health, which is Doc Elby's project.
Yes, ma'am. Thank you, ma'am. To Sir Leo, your advocacy for Filipino nurses has a unique angle in tackling global health challenges. So how has it intersected with education and leadership in healthcare?
Okay. To be able to advance yourself in the United States as a Filipino nurse, it's important to have advanced education. One of the great things that I've done early on when I went to America in 1988, within a year time, I decided to go back to my master's studies at New York University. And in 2 years, I finished that. I was able to go back and teach. So foreign educated nurses would not find themselves in executive suites or in managerial role if you don't go back for advanced education. Let alone, example, Janet Cuaycong here, she finished her master's in nursing education, in nursing. So she is now a manager. Dr. Elvy Barroso here, she has to go further for her education, get her doctoral education to be able to teach. I would not be in my position right now as a dean for College of Healthcare Professions if I didn't go for my PhD. So obtaining that doctoral degree or obtaining your master's degree basically allows you to lead, allows you to be at board of nursing, allows you to be at the discussion table of those making regulations and legislations for healthcare. And one of the things also that I'm proud of is that when I was the president of the Philippine Nurses Association of America, I thought that Filipino nurses would have a way to disseminate their research if we would come up with a peer-reviewed journal. And as a result, I launched the peer-reviewed journal of the Philippine Nurses Association of America, the Journal of Nursing Practice, Applications, and Reviews of Research, so that Filipino nurses who are going for their advanced education can disseminate what they've studied.
That's incredible, Sir Felix. Dr. Barroso, you've made great strides in tuberculosis control. How do you see the future of public health in underserved communities in the U.S.?
So, Filipinos do not fully understand the two phases of tuberculosis: the latent tuberculosis infection and the active tuberculosis disease. So in the past, we focus on active case finding, wherein we look for those that have active TB disease. The new development now is to look for those with latent TB infection, screen them, and give them treatment to prevent them from developing the active TB disease. So our challenge now is to educate communities, especially the ones that are in rural areas or in the suburb, to make them aware about the latent tuberculosis infection so they can be screened and they get treatment to prevent them from developing the active TB disease.
Ma'am, how long have you been working with this, with your community?
So in New York City, in 2014 and 2015, Philippines is one of the 4th among 10 countries with high number of TB cases in New York City. So what I did, I spearheaded the outreach activities. I collaborated with the Philippine Nurses Association of New York and other Filipino-based organizations in Queens, where most of the Filipino lives. And we conducted TB education. We did TB screening, and from 2014 to 2015, Philippines went down when it comes to the rank. And our latest data in 2023, Philippines now is the 8th. So from 4th, it was relegated to 8th among 10 countries with high number of TB cases in New York City.
I mean, how many Filipinos had been infected with tuberculosis?
We did a research about this together with the Philippine Nurses Association of New York, and we hired 2 Filipino Tagalog speaking. So what we did is they accompanied all those, because the problem in New York City is that we are able to convince them to come for TB screening.
Oh.
But when we scheduled them to come to our chest center, the Department of Health chest center, they do not show up.
They were hesitant.
They're scared. They're not comfortable. Some of them don't have legal papers. Some of them don't have insurance. So what we did in our research, we hired 2 Filipino Tagalog speaking, and
To convince them.
no, they accompanied them to our clinics every visit.
Okay.
To make them comfortable to come to our clinic. So because of that, before, when it comes to accomplishment, when it comes to how many Filipinos come to the chest center for evaluation, we only number like 20%.
Okay.
In our latest data, we had 82%.
Wow.
So it's a big.
Yes.
Yes, well, thank you po. That's a very powerful version. So, to Ms. Zita, your work in labor rights advocacy tackles the most pressing global challenges. And how do you balance advocacy and direct action? You said earlier that you are a survivor of labor exploitations. Can you share more about your experience so that the other Filipino workers can gain knowledge?
My experience is really it's a strong topic that pushes me in my advocacy. because in my own experience is that I've seen that how can I claim my rights if I am undocumented? How can I claim my rights if I have a language barrier in the country where I am? Two things that I have in my mind is learning. I said I need to learn
Language.
for justice. So I learn, I've done trainings. The labor union have put me at school. I started learning French. I was crying, in fact, at the beginning because when I was already in the union, I speak only 3 words of French. Bonjour, bonsoir, au revoir means hello, good night, and goodbye. So I said, if I will not learn, I will stay where I am.
How long did it take you to learn the
To
language?
learn the language, it's a long process. So, and at the same time, I was working because I declined at the beginning when the labor union said that you are going to be employed at the union. I said, oh my God, you are going to employ me. I speak 3 words of French, and how can I take my responsibilities. This is the first professional union in the central region of France. It's the Paris region and covers 8 departments. And they said to me, oh, don't worry. We know your capacity and we know that you can make it. So in my mind, because since my childhood, I wanted to go to school. And it happens that because of poverty, my parents would not able to put me at school. And at grade 6, my father said, you will no longer continue your studies because we cannot afford to pay your studies. And I said, I was so upset. And I leave my family. I've been in Manila, so I'm really a domestic worker, local domestic worker in Manila. So when the union offers me that, in my mind, I said, oh yes, why not? Because if they trusted me, maybe this is the occasion or the chance that I can have my studies. So I was not wrong. I was happy because when the labor union have already settled my contract, at the same time, they put me at school. My French language learning, my training on how to defend workers, how to organize workers as well. And many of the members are Filipinos. In this union, before when I arrived, there are only about hundreds members. And my first year, it's growing like that. The French people said that it's growing like the mushrooms, because when the mushroom is growing, it's spreading like that. And we said that, oh, Zita, you're doing a very good achievement. So I was a general secretary of this union, and every year my achievement was growing. And I'm very proud because the labor union also put me. I was selected already as a member of the Federal Bureau. So the Federal Bureau is a place where we negotiate the rights of the work, where we prepare the collective bargaining. And I was one of the decisioners, and I was also became a policy making, a part of a policy making. So I learned a lot. Until I've seen many people coming, because when I do advices, I work with lawyers. I became also the decisioner of all cases going to the labor court. Without my green light, the case will not be in front of the judge. So I learned a lot. It's a reason why I feel very blessed, because I live Philippines. I live my hometown with an empty baggage. And now I'm coming back with this overwhelming recognition. And I always say that this recognition is not recognizing my work, but it's recognizing the crime that I'm fighting for today. Because as a victim of human trafficking, when I see human trafficking, is that illegal recruitment is still reigning.
Rampant.
It is still pioneering our country, and many innocents are victims. Many, especially the women coming from rural areas, the lack of education, poverty, victim of floods, many things. So they are all vulnerable. So my fight today is to bring those people back in a normal life, and we survivors will be included in a round table to improve policies, to protect our country as well, and of course, all the people who are already impacted of this kind of crime.
So when we come back, we hear the final word from our roundtable discussion participants, inspire the next generation, trailblazer in their field. So this is Sulong sa Bagong Pilipinas, hosted by the Manila Times.
And we're back to Sulong sa Bagong Pilipinas. To conclude the roundtable discussion, let's hear inspirational words from our participants.
So awardees, what are pieces of advice you could give to aspiring professionals like you? Tell us reflections on your legacies and future projects.
Let's start with Dr.
Dr. Senicas.
Yes, so really listening to their stories, I can think of two things that are really important. I think one is really never stop learning. You have to continue to study, learn something new, learn a language, advance in your education. Because if you don't, you will not be able to improve or move up in your career. I think that's one important thing. Second thing, I also thought about collaboration. So in what I do, in Dr. Leo, in the Philippine Nurses Association of New York, I think it's very important to really collaborate with others who are doing something similar to what you're doing, because if you do it alone, you can reach something, you can achieve some goals, but I think if you do it with the community, if you do it with other people, if you collaborate, you will be able to achieve more. So I think those two things, really never stop learning and collaborate with others, because it's really more impactful if you work together.
Yes, Sir Leo.
Actually, I will echo Dr. Senicas. Actually, I had been thinking about that. Embrace lifelong learning. It's so important to ensure that you keep growing, and with that, diversify your skills and talents. My bachelor's is in nursing and in English, and my master's in healthcare delivery system, and my PhD is in urban healthcare systems. So you are not boxed into one specialty. I'm a certified nurse educator. I'm a certified nurse administrator. I'm an advanced practice nurse in adult health. I'm a certified online educator, so that if you don't enjoy doing one thing, go to the next. That's why it's always important to diversify your talent and skills. Third, it's good to be involved, to get involved. I would say that one of the things that really propelled my career is joining the Philippine Nurses Association of America. Did I ever think that I would become a president? No. But when I became a president, I was able to introduce many programs, like the building of the 𝗏𝐻𝐀𝐅𝐈𝐎𝐻 village in Bulacan, which now has 50 homes for those underprivileged. The 𝗏𝐶𝐂𝐻𝐿𝐴 awareness program in terms of kababayan emergency preparedness program. I was able to do that through the Philippine Nurses Association. And I guess Dr. Senicas mentioned about collaboration. So get involved, volunteer, and think about your homeland. Every 2 years, we come do balikturo. The Philippine Nurses Association of America do balikturo, where we go to different colleges and universities, as well as different healthcare system, to provide the latest evidence in terms of nursing care, healthcare, disease management, that type of thing. So, yes, it's important to keep growing, get involved, collaborate, And I'm sure the rest of my colleagues can add more.
Yes, ma'am. Dr. Elvy po.
Yeah, my goal is to help reduce the burden of tuberculosis among Filipinos in New York City through early diagnosis of active TB disease and treatment of latent TB infection. So it is my hope that in the near future, Philippines will no longer be on the list of 10 countries with high number of tuberculosis in New York City. Now, I wanted to bring awareness to our young generation. They are our future. If they know how to stop the spread of tuberculosis and if they know the importance of treating latent tuberculosis infection to prevent them from developing TB disease, that will bring great impact in reducing tuberculosis, not just in New York City, not just in other countries, but in Philippines.
Yes, Ms. Kenneth.
Inspirational words, I could only say that anything, even small, how big or small, act of kindness has an impact. So we have to be involved, as Sir Leo was saying, and continuous learning. In nursing, there are so many things that we can do, be involved in a community. Philippine Nurses Association of New York, member chapter of the Philippine Nurses Association of America, encourage everyone who to be involved in the community service, because as we want to give back to our communities, like what Sir Leo was saying, Balikturo is one. We have so many activities, we have so many programs. Not only that we provide educational activities to our neighbors, but we also provide support. We are training our nurses emotional support, especially that the recent pandemic had left out with a lot of mental health issues among healthcare workers. So there's so many organizations out there that would help us champion our advocacies as well. So we need to collaborate, continue collaborate, and be present to our community and give back.
Thank you, ma'am. Ms. Zita po.
You can speak in French, ma'am, if you want.
Yeah. On peut parler français. We can speak French, no problem. Yeah, my conclusion is, allow me first to tell that, yes, we can always conclude what we are doing today. But for me, the conclusion is very far because this is only the beginning. Learning, as I said since the beginning of my talk, is the best way to make a challenge to offer to our kababayans to raise awareness and of course expand partnership, especially the Philippine institution, because what we are talking about now is Filipino are concerned, even though we are involved in other countries. But I think first is we will do to our countrymen. I think my experience, I will not stop telling my story in front of those people, in front to all of you, just to remind that this exists and we should not stop doing to fight the phenomenon. And I think the important thing also to remember is that we should put an eye to a phenomenon that are breaking, keeping the silence. We are here to break the silence, in fact. So breaking the silence, a survivor can break a silence and can make also an innovative solution for the future.
If you, ma'am. As we come to an end to this remarkable conversation, I want to take a moment to reflect on the incredible insights we gained from our esteemed guests. Today, we explored the profound theme of sulong sa bagong Pilipinas and what an inspiring journey it is.
Our incredible panel, thank you for your time, your insights, and most of all, your unwavering commitment to making the world a better place. You have not only educated us today, but inspired us to believe in the power of advocacy and action. So thank you everyone who joined us this important discussion. So until next time, let's continue breaking barriers and building bridges for a brighter, more inclusive future.
Thank you.
Thank you.
Thank you po. Thank you po.
Thank you.
Thank you.